audience, we have with us Dr. Neha Gupta, Senior Infectious Disease Specialist, MD Medicine, who's going to enlighten us about how threatful is this new COVID-19 variant, JN.1.
Okay, so basically JN.1 is the new variant of COVID-19. हमने पहले से ही देखा हुआ है कि COVID-19 since it's arrived in 2019 and 2020 in India, so तब से बहुत सारे variants आए हैं. पहले था alpha variant, then we have the delta wave, so then we had the Omicron variant. So these are all variants, मतलब these are all types of COVID-19. Virus जब multiply हो रहा है and spread हो रहा है from one patient to another patient, it is basically changing. It just keeps on mutating, so it changes its behavior, and those variants are known as the typical names which we have given. And the JN.1 variant is the recent new variant of COVID-19. So JN.1 variant again, seriousness, how serious it is and how severe illness it's causing, we don't know. Most of the cases जो अभी हैं, they are basically mild cases. But yes, जिन patients में कोई comorbidity है या elderly patients हैं, उसमें ये थोड़ा severe illness भी कर सकता है. Exactly, it's of course it will depend upon how it evolves, and as we see more cases, we will be wiser.
डॉक्टर, कितना आपने बोला डिफरेंट वेरिएंट्स हैं इसके, तो कितना कंटेजियस है ये नया वेरिएंट JN.1 वी कंपेयर टू अदर वेरिएंट्स, ये कितना ज्यादा कंटेजियस है?
So JN.1 variant, हम जो contagiousness उसको हम measure करते हैं, that is by the R0 factor or the reproduction number. So इस particular variant की JN.1 variant is actually the R0 value is higher as compared to the previous variants. So it is more infectious. In fact, currently 30 to 40% of the COVID-19 all over the world is because of this JN.1 variant.
So हमें क्या precautions लेने चाहिए डॉक्टर ताकि हम सेफ रह सके? ये इतनी तेजी से फैल रहा है, 2500 केसेस रिपोर्ट हुए हैं रिसेंटली.
देखिए, ये चूंकि ये COVID-19 है, सो बेसिकली इसके सिम्टम्स क्या है कि पेशेंट्स को होगा फीवर होगा या फिर रनिंग नोज, कॉफ, सो थ्रोट, मैल्जिया हो सकता है, डायरिया भी हो जाए. तो इसमें सिंस इट स्प्रेड्स, इट्स अगेन लाइक कॉन्टैक्ट एंड ऑफ कोर्स एयर, more importantly close contact, and so इसलिए it's important that we wear a mask. So the mask has to be back, and we have to focus on hand hygiene. So use of sanitizer. आप avoid थोड़ा करें crowded places को, closed spaces को. And इसके अलावा one has to build up the immunity as well. In case immunity, basically you have to keep up to date in terms of your exercise, diet, good diet, vitamin D, vitamin B12 levels. And besides that, it is like in case अगर cough वगैरह है तो try करें कि आप थोड़ा isolate, मतलब you should just have cough etiquettes as well.
डॉक्टर, जैसे कि अभी विंटर है, अभी ये जो सीजनल चेंज हो रहा है, ये विंटर टाइम है, क्या चांसेस हैं कि इसके कारण से, ये सीजनल चेंज के कारण से भी ये स्प्रेड करे लोगों में?
Yes, of course. I mean, पहले भी देखा गया है कि जैसे विंटर्स होते हैं वैसे ही chances of viral infections या फिर hospitalizations also increase हो जाते हैं. So during winters, yes, and with the pollution, especially in the Delhi NCR region, the cases are likely to go up. So one has to be careful about it.
जो नया वेरिएंट आया है, ये कौन से एज ग्रुप को ज्यादा इफेक्ट कर सकता है?
So जैसे ही हमारे, it's basically elderly people more than 60 years of age, जैसे हमारी एज बढ़ती है वैसे हमारी इम्यूनिटी कम हो जाती है और उसमें chances of infection increase हो जाते हैं. Patients with diabetes, because diabetes में again immunity is low. Those who are smokers, those have allergies, lung problems, allergic bronchitis, या फिर chronic lung diseases, heart diseases, liver diseases, kidney diseases, and patients जैसे कि cancer patients या फिर those who are taking some kind of immunosuppressants. So उनमें भी chances of infections are much higher.
So is a booster dose important? Should we all go for the booster dose and take the dose?
So, booster dose is basically it's a topic of ongoing research as well, and the experts feel that currently it depends from which part of the world we are in. हम इंडिया में more than 90-95% people have taken the 2 primary doses, right?
Oh,
So
yes.
most of us are vaccinated. Now there's data also from Singapore and other places that अगर मान लीजिए आपने COVID-19 का वैक्सीन लिया है और
Hmm.
1 साल के अंदर आपको कोई इन्फेक्शन हो जाता है तो उसकी
Hmm.
सीवियरिटी कम हुई है. Whereas if the vaccine has been taken 1 year earlier, then the
Hmm.
severity has been found to be more. So the current the experts, we all feel that probably, and even yesterday the WHO has recommended that yes, booster dose can be offered or to people who have got high chances of severe illness or more serious disease with the COVID-19 variant JN.1. So हर किसी को obviously अभी ऐसा नहीं कि हर किसी को लेने की जरूरत है, but yes, those who are at a higher risk, या फिर अगर फैमिली मेंबर्स हैं जिनकी फैमिली में कोई पेशेंट है जिसको की चांसेस है कि उनको सीवियर इलनेस हो सकता है, जैसे एल्डरली पेशेंट्स या फिर पेशेंट्स जिनको बहुत अनकंट्रोल डायबिटीज है या कोई और कारण से जिनकी इम्यूनिटी कम है, तो दे कैन ऑल्सो टेक द एडिशनल बूस्टर डोज.
What precautions should a pregnant lady take so that she can avoid the complications of this new variant?
Okay. So I think in pregnancy, again, this first is always with your diet and lifestyle. Then, of course, it's your COVID-19 standard precautions of mask, hand hygiene, keeping a social distancing, with effective vaccination strategies. So, vaccination with influenza, and of course, one can consider the booster dose also, but
Hmm.
especially the vaccine with influenza is also very important.
Before we conclude the session, what message would you like to give to our audience?
I would like to say focus on your health. If you have health, you have everything in life. So just focus on your health.